Welcome back to the big picture. The positivity rates for COVID continue to be higher in Western New York than other parts of the state. So as the need to get vaccinated continues, is there still a need to get tested? Our next guest says, yes, there is. We welcome David Avendanza, Director of Operations of Mobile Testing Western New York, to tell us why. Hi, David. David, do you think we should mention that you're a prominent business area businessman who saw a need for this type of testing and started this on your own?
Well, let me thank you first for being here. I really appreciate this. And yes, we saw that there was a lack of information that was out there, and this is going back to the middle of 2020. There was also a deficit in the areas that you could go get tested in case you needed to be tested. And the biggest problem was really trying to find out which test you needed at what time. And these are all very important factors in staying safe during.
Now, the public has heard, and I've heard, that testing that offers immediate results may not always be accurate. And I worry about that, and I'm sure other people do. Is that true?
Oh yes, we get a lot of calls with those concerns. The main concern is that it's going to be a false negative or false positive. First of all, when you do receive a false reading, it's mostly false negatives, which unfortunately will give you a false sense of security if you are positive. The biggest factor involved in whether or not the test is very accurate is the time you're taking the test. Something very simple to understand would be if you are going to go get a rapid antigen test, and this is a rapid antigen test. It's associated with nasal pharyngeal sample, which it's a brain tickler. It's going to go way up inside.
When you see on television where they stick something up your nose for the test.
Yes, and that's a rapid test, and that's going to detect antigen, which is associated with the live virus. Now, to make this test be as accurate as you can have it be, you can't run and take this test 2 days after being exposed, 3 days, 4 days. The window for detection for an antigen test is best between 5 and 13 days. After that window, this test is no longer accurate. And a lot of people have been depending on these tests to define whether or not they're safe or not around their family. What they need to do is they need to ask an expert. They need to ask their doctor, which test should I be taking today if I feel I was exposed yesterday or the day before? Now, if that's the case, you'd want to take a PCR test. Now, normally a PCR test would be, you go to drive-through, they do the same thing up the nostril, they send it away for a couple of days to a lab. PCR stands for polymers chain reaction, which is basically they're taking a sample and they're multiplying that sample so that it can be read more accurately. That way, if you have very little virus in your system, it'll multiply it so that the system will register, yes, there is virus in that system. Now, there's other rapid tests. This test, for instance, is a PCR test. This is the test that we help people get back to Canada with right now. They're being turned away at the border, and they're also being turned away because they're taking an antigen test, and Canada requires a PCR test. This one happens to be a test that we can do the service, record the results, report the results, and issue them a paper to get across to Canada all within an hour. Normally, this would take a couple of days because it has to go away to a lab, and then the results come back and you either go on the online patient portal to find that out, or someone will call you and let you know what your results are.
Do you go to people? It says mobile testing. Is there a reason?
Yes, we do. One of the reasons why we did make this mobile was because, again, in the middle of last year, a lot of our most vulnerable population were much older. They weren't as mobile, and plus, I wouldn't recommend a family member to take a very elderly family member into an area where you will most likely have many infectious people. So what we did was we came up with something that would be as safest, to mitigate as much of this spread as possible, so we can come directly to you. And a really great thing was when we partnered with Lewiston Fire Station number 1, and they gave us a space in the fire station, and we set up something where people could have appointments at 5-minute interval. So nobody's waiting in a line, nobody's crowded in anywhere. It still, again, mitigates the spread, and it makes it safer for people to get tested.
Is there a pre-symptom detection? Because I told you before I was reading that a way to get people back to work would be if they could test themselves or have tests without symptoms. In other words, just to find out if they're okay, and then they could go back to work safely.
Well, you're definitely
Or
correct.
school, I guess it would apply to school too.
Yes, anywhere where you want to send schools, universities, and businesses, and just mostly the general public itself. And you're absolutely accurate by saying that if you could get tested and know what's up, then you're operating with correct information. A lot of tests are going to be coming out now. You're going to see a lot of tests that will be home use tests. The home use tests, they're better than not being tested. I'll say that, okay? A lot of them are going to be very inexpensive because we did find out that we weren't testing enough at all. If we tested at the beginning, it would have been better. Now you need to test to be able to make a proper judgment with you, your own family, and your safety. And the ways to do it, again, if you want to get a home test, call your professional, call your doctor or medical professional. They could probably recommend a test that you could buy to keep in your home so that you could use it in whatever situation you'd like to use. Yeah. Mostly those tests will be just the little nasal tests, not the real deep nasal pharyngeal tests. Yeah. And they will be antigen tests.
What's the difference? You mentioned antigen.
Oh, well, the main difference between the rapid tests are, because people say rapid test and they think it's one test, but these are actually 3 different tests. I've shown you the antigen test. This is a PCR test. This is probably, and perhaps the most important test that you could get, is an antibody test. Antibody test is going to define whether or not your vaccine is working. It's going to define whether or not you've been exposed in the past. It's going to define whether or not you've been recently exposed. This happens to be a dual antibody test. It's serology, which means you get a little finger lancet. I'm sure that people have been familiar with a test for blood sugar. It takes a little poke on your finger, a drop goes in there, you put the reagent in, and in 15 minutes, it'll tell you if you have either IgM antibodies, which is that initial immune response to try to clear out a virus of any kind from your body, and most importantly, IgG, which is really what they're all looking for. All the doctors are looking for a strong IgG response to either taking the vaccine, or if you have been exposed in the past, it means that your body's built up this immunity and now you have a defense against reinfection.
What do you tell somebody, a customer, a patient, if they do test positive? What do you tell them to do?
Oh, well, that's pretty much standard. Most people understand that they have to quarantine. The CDC guidelines, the WHO guidelines, they're all very clear. They've come down from 14 to 10 days. What I can do is, if you're someone who has taken one of our tests, we can get a little more specific on it. If you took the antigen test and you came up positive, that's going to mean that you're somewhere in the middle of a live infection. So you will have, just say, a little less time to be infectious than you would if very early discovery from a PCR test took place, because that's going to let you know the entire time that you're going to be infectious. This may be just half the time you're going to be infectious.
Right.
But still, you want to wear a mask, kind of distance yourself from people, and just stay in quarantine if you can.
And how are you and your team, you guys, staying safe when you're doing these tests?
Well, that's fairly easy. We've all had the vaccine, and we also, of course, gloves, masks, shields, and gowns when necessary. In most cases, it's just gloves and a mask because you're with the person doing the test. It takes about 10 or 15 seconds to actually take the test. So we're really not exposing anybody to anybody else.
So you're on board with the science that says you have to be exposed for 10 or 15 minutes even to a person with, I keep reading that, to a person who is positive for you to get the virus?
Well, a lot of studies are coming out, even more so because they're getting better at this. We got to remember that the reason why there's so much attention on this particular coronavirus, because coronavirus is the flu, this is a brand new one that the human body has never seen. That's why we have so much attention on it, and that's why it affects people like it does. We do know that the infection takes place from droplets, and it takes place through this distance and the air. There's argument on how long you have to be with a person, how close quarters it needs to be. Those studies, there'll be more and more of those studies coming out every month.
Correct.
But we can all agree that something that I've just been discussing, which is the theater of hygiene, is something that we've really put a lot of effort and a lot of motivation into, and it really doesn't mitigate anything. You'll see everyone sanitizing and disinfecting and buying these supplies and taking all this time, when in fact, just the mask does 50 times better job than, because you can't really, the chances of getting from a touch surface, it's very, very low compared to what you just said, which is talking to somebody.
Right, and we'll tell our viewers we're both vaccinated.
Oh, absolutely. And we're also 6 feet apart.
Okay,
so
all
that's
right.
good
So
too.
what is the cost? Does insurance cover any of these tests, or what is the cost, or how does it get taken care of?
Well, we've kept, at mobile testing, we've kept the cost very low. And like I said, again, in partnership with a location like the Lewiston Fire Hall, it's been excellent because part of the donation of the test goes to the fire hall. And the thing about the insurance for these, if you go to a drive-through and you're going to get a PCR test that goes away to a lab, that's covered by your health insurance. These rapid tests, they aren't covered by health insurance. And what they don't tell you is, a lot of these places don't tell you, and please, if you go get a rapid test, save your results, save your receipt, scour your health insurance website, find that form that says out-of-pocket medical expenses, fill out all the information with your results, and as long as you have an FDA-approved New York State test, in most cases I've heard that they actually reimburse you. But they're going to make you jump through hoops to get it.
Of course.
Yeah,
yeah, that should
they
be
will.
known. I said we're both vaccinated. Should people who are vaccinated need these tests or take them at any time?
Well, again, the most important test of all of these tests, I would say overall for the general public, is the antibody test. Once you've been vaccinated and it's been about 3 weeks to a month, you want to get one of these tests because this is going to show you if your body is having the proper immune response. What we're finding is a very small percentage, but it is a percentage, a very small percentage of people are not responding to this the way that that you want to with the amount of antibodies and the long-term antibodies, which is the IgG antibodies that I had discussed. If you find that out, then what you can do is go to your doctor and say, I received the Pfizer vaccine, yet these are my results. And what they'll do is they'll give you a full serology test, blood chemistry, and they'll find one of the other vaccines, because each one of these vaccines is slightly different, and that will help you get full coverage on for immunity.
Right, and they say everybody has a different reaction to the different tests, and that's because just what you're explaining, or that you have different antibodies and people have different reactions because of that.
Absolutely. People have different you'll see that some people, when I received the vaccine, it was like I didn't even go that day, and then somebody else gets the vaccine and they're down for 3 days.
Me too. I thought they gave me a placebo. I didn't feel anything except my arm hurt. But as you said, other people have a big reaction.
And that has to do with your blood chemistry and your genetics. And they're the more they do the research, and of course, in the past, populations were nowhere near this large that were being vaccinated. So of course they're finding outliers and small percentages of differences. But overall, the vaccine is so safe and it will help you if you are exposed.
Right.
Absolutely.
Well, now let's tell everybody where they can find you and how they can find you.
They can find us online at mobiletestingwny.com. We have a lot of information for the public there. They can also find us in Lewiston at the fire station, but if you go online, you can make an appointment and find all the necessary information. Or they can call. They can call our number at 716-371-2600, and please call, even if you have a question, because that's why we started this. We started this because there were a lot of questions, and advice doesn't cost anything but time.
And people have so many questions. It's really a public service, and we thank you for your service, for giving us all this information. And we thank you, David, for joining us on The Big Picture. Remember, we want everyone to stay safe so we can continue to beat COVID together.